pregnancy and fertility issues. So let me just talk about pregnancy first. There's more and more literature that, fortunately, there doesn't seem to be spontaneous abortions or stillbirths. For those of you who can see this chart, there's a chart there. Yellow is pregnant women with COVID, or the orange, and the blue is pregnant women without COVID. And as you can see, there's maybe just a tiny bit increased incidence in stillbirths and problems with the baby if you're pregnant and you develop COVID, but there's a significantly greater risk to the mother. So pregnant women do much worse if they get COVID, and we've seen people here, pregnant women on ventilators. So if you compare somebody who doesn't have COVID, a pregnant woman, to a pregnant woman that has COVID, they do much worse, and that's what this chart reflects. Your risk of being on a ventilator, having severe illness, having prematurity. Actually, the baby can be born earlier. That it's, again, having COVID during pregnancy is not good. I'll just kind of say it at that, and then again, we can try to answer more specific questions. And I can tell you, there's a little bit, and this is where it's a little bit vague. The FDA historically, if you don't do a trial that includes pregnant women, they will not give an indication for that. They will tell you, if I tested an antibiotic and I don't test it in pregnant women, they will say, we are not giving an indication in pregnancy unless you can prove it's helpful. They weren't able to do that in a timely manner, but what they actually came out with, which is pretty exceptional, is they said, we're not going to say it's absolutely safe, but we are not saying withhold it, and we're saying you should strongly consider it. And as time's gone on, and the registry of pregnant women who've been vaccinated is so huge, and they're not seeing any problems with the vaccine, that all of these specific societies who are experts in this, like the American College of Obstetricians and Gynecologists, are strongly recommending vaccination in pregnancy. And again, they don't like their pregnant women ending up on ventilators and having horrible outcomes, right? And there's no literature that the vaccine will adversely affect either your pregnancy or the outcome in any way. The other issue, this is really tough to prove, again, is this issue of infertility. So a scientist, pseudoscientist, claimed that there's a reason that this would affect fertility. And there's a protein on not on mine, but on placentas that is called syncytin 1. And someone said that protein looks a lot like the spike protein on the vaccine. So they said, you know what, if your body's making a reaction to the spike protein, it can make a reaction to placentas, and it can make it so that you couldn't have a baby. There is absolutely no scientific foundation to that. And actually, I've kind of looked at analogies and some of the experts that talk about this, and they said it's pretty much the same as if you have two Social Security cards and you share one number on the Social Security cards, then you have the exact same Social Security cards. I mean, there's a couple of proteins on everything that have some shared amino acids, or they look a teeny bit the same. But there is absolutely no immunologic reason to believe that the antibodies that you develop to spike protein would affect syncytin. And it's actually on the spike protein, there's 538 amino acids, and there's 4 that are shared. That's it. They're conjoined or next to each other, right? Which is essentially, you talk to genetics experts and epidemiologists, and they'll say, these are so dissimilar, this is ridiculous. There's no scientific foundation for that. And then there's a couple of real world examples of this too. So one of the examples is you look at all the vaccine trials, and I've already mentioned they did not enroll people who were pregnant in the vaccine trials, but people got pregnant that were in the trials. And you would think that if this affects fertility, the people who are vaccinated would have a harder time getting pregnant, and it turned out that there was exactly the same number of people, or within a couple of people, in all the trials that were vaccinated or not vaccinated that got pregnant. So that doesn't make any sense why it would cause infertility. And the other thing is they're looking at these the other thing is, you'd think is, since it's the spike protein, your body, I've already shown that your body makes antibodies to the spike protein, so why wouldn't it make antibodies to the placenta too? There's absolutely no evidence now, looking at huge registries throughout the United States, that people who are infected are having a hard time with fertility. And you would expect that people who are infected would have a huge difficulty with fertility. So there's, again, essentially no literature on this. And as I've mentioned here, there's three major organizations that I think everybody looks to. I'm not an obstetrician or gynecologist, I'm an infectious disease person. But the three major organizations are the American College of Obstetricians and Gynecologists, the American Society for Reproductive Medicine, and the Society for Maternal and Fetal Medicine. And they have all came out with a joint statement saying there's absolutely no evidence that the vaccine can lead to loss of fertility.